Hey everyone, my name is Kate Conkle and I am an Action Center Team Director with County Health Rankings and Roadmaps. I want to welcome you all to Making the Most of the 2018 County Health Rankings webinar. This webinar is to help you prepare for the rankings release on March 14th from both a data and a communications perspective. So the County Health Rankings and Roadmaps program is based at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. Today, I'm joined by a small team of colleagues. Let me welcome Amanda Jovag, our Rankings Team Director.
Hi, everyone.
And Ali Havrilla, a community coach, and she's going to be helping to answer some questions and monitoring our chat throughout the webinar.
Hi, everybody.
And finally, not on sound today, on audio today, but Annie Roble is going to be in the background helping to answer some questions. You might see her name come up if you ask a question that we respond to in writing. So I'm going to turn things over to Ali now to walk through how you can be an active participant on the webinar today.
Great, thanks, Kate. And I just highlight that we did just chat out the links to today's slides and some resources that we'll be referencing. So I encourage everybody to check out the chat box. And if you joined us a few minutes early, you saw the quick introduction video. And for those who are just joining now, we'll do a quick overview of how you can participate in this webinar. If you have questions for our panelists, simply click on the Q&A control. And when you do, the Q&A box will open up. That's where you type in your question and then click send to submit your question. And we encourage folks to send in their questions anytime during the webinar. If you want to share an idea with all of the attendees, use the chat to make comments or respond to questions that we may ask you during the webinar. To use the chat feature, click on the chat control. Then the chat box will open up and type your comment here. Then press enter to submit your response. You have the option to chat with all attendees or with the panelists only, and we ask that if you're comfortable, share with everybody so that other participants can see the ideas that you're sharing.
All right, thanks, Ali. So now that you are oriented on how you can participate in the webinar today along with us, we're going to turn to what we want you to get out of today's webinar. So first, we want to share some of the new features and resources in the 2018 County Health Rankings. We'll give you some tips for using featured tools and resources, and we'll discuss some strategies for how to leverage the rankings release to spur action in your community. We will have time for questions, but we also want to remind you that directly following today's webinar, we're offering 2 virtual discussion groups. One with Amanda and Ali, and that will primarily focus on the data side of things. So if you've got more data type questions, that will be the one to join. Or you can join myself and Annie. She's also a member of our rankings team. And in that one, we will talk a bit more about using the rankings to move to action. It's extra time to answer your questions. If you want to discuss both and you're not sure which room to go to, either will work. And during that time, we'll invite you to share your experiences and ideas for the upcoming release with us. And we are going to provide links for each of those sessions in the chat box towards the end of the webinar. No registrations required. The links will take you directly to the Zoom meeting. All right, so moving into some of the content, I wanted to start with, when they hear our data resources, the first thing that usually comes to mind are the rankings. They're one of our primary data tools. We are, after all, County Health Rankings and Roadmaps. And this picture shows the thinking behind the rankings, really about how the rankings can be used as a catalyst for action that improves the health of everyone in a community. So we're going to walk through this. We start with population-based data that comes from a variety of sources, and then we use that data to rank the health of nearly every county in every state. Ranks, it turns out, are great for garnering attention, and each year the rankings report release generates national, regional, and local media attention. It also provides an opportunity for people to tell the story of the many factors affecting health in their community, what's going well, and where there's an opportunity to make things better. You can then use this information as an opportunity to mobilize multiple sectors to look further at the community's strengths and needs. And based on this deeper look and at your unique priorities, community members can identify evidence-informed strategies that can be implemented locally to make change. Over time, these strategies ultimately result in longer, higher quality lives for everyone in the community. So essentially, the county health rankings are a data tool, but they aren't just about numbers. They're also a call to action, and you can use the rankings release and the attention that comes with it as a way to either start or continue a conversation about health. I'm going to talk a little bit in a bit about how you can use it as a call to action, but first, I'm going to turn things over to Amanda to share the data side of things.
Hi everyone, this is Amanda, and I'm so excited to be talking to you all about this year's release. We've put a lot of work into it and have a lot of new features available, and I'm just really hoping it's a great new resource for you all. Let's get into the data. So data is a resource that can be used all throughout community health improvement processes. It can be used for uncovering health issues in your community, finding where and with whom they're located, and getting to the root causes of issues. The rankings can help your community with all of these steps. Today, we're going to help you maximize your use of the rankings and its data. So first, we'll talk about what goes into the rankings and its data. Next, we'll take a quick tour of the current website to visit some of our don't miss tools. This year, we're adding some new and exciting tools to the website that I'll give you a preview of. And finally, I'll introduce our revamped state reports that highlight our program's focus on achieving health for all. Let's get started. So I'm sure many of you have seen this model. It underlies the work of the rankings. One of the goals we've had with this image is to help change the conversation about health and what influences health. What this image shows us is that health is more than what happens at the doctor's office. A wide range of factors influence how long and how well we live. It includes things we often think about when we hear the word health, like health care and how well we eat and how much we move. But we know that it's also things like education and income, the quality of our housing, and the safety of our neighborhoods. Starting from the bottom, we know from research that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. Many health factors, those are the blue boxes, shape our community's health outcomes. We specifically look at health behaviors, clinical care, the social and economic factors, and the physical environment. We measure two types of health outcomes, those are the green boxes, to show us how healthy each county is: length of life and quality of life. So how does that model translate into measuring health in counties? We have 35 ranked measures, none of which has changed from last year. You can find a PDF of this year's ranked measures, their data sources, and the years of data that we were able to access this year. So that is in the links that were chatted out at the beginning of the webinar. It's the one that says links. It's on the second page. And you can open the file and follow along as I briefly point out the areas that we measure. So to measure health outcomes, we have 1 measure of length of life and 4 for quality of life. Health behaviors include 9 measures of smoking, diet and exercise, alcohol and drug use, and sexual activity. Clinical care includes 4 measures of access to care and 3 measures of quality of care. The social and economic factors are measured with 9 measures of education, income and employment, family and social support, and community safety. And the physical environment includes 2 measures of air and water quality and 3 measures of housing and transit. This year, we're not going to talk through all of the 35 ranked measures as there are no new measures for this year, just updated years of data. So our measures were selected using a variety of criteria. Measures must meet a variety of technical and feasibility criteria, as well as be appropriate for our program's goals and also meet community needs. Technically, measures need to have a strong link to health. They need to be available at the county level for nearly all counties in the nation and have a relatively short time lag. We don't like measures that are too old. So to meet our goals and meet the needs of communities with the mindset that fewer measures are better than more, any new measure must bring added value without diluting the model. our measures have to reflect a modifiable aspect of community health, and they have to be easy to communicate, or at least as easy as possible. If you're interested in learning more about our criteria, we've included a link to a document that lists all of them in that PDF of resources. So that's another thing to take a look at after the webinar if you're interested. If you opened up the list of measures, you would have seen that there are almost as many data sources listed as there are measures. This is the list of the more than 20 data sources that the County Health Rankings rely on. I want to give a particular thanks to the Behavioral Risk Factor Surveillance System and the National Center for Health Statistics at the CDC, and the Dartmouth Atlas of Healthcare from the Dartmouth Institute for the data that they've calculated and provided for us. Well, that was a really quick, high-level summary of the measures and methods that we use to construct the rankings. In order to give us the time to help you get the most out of the rankings, we're skipping a more in-depth look at the methods. If you'd like that deeper look, please watch the 20-minute webinar that we recorded that describes what we do in very specific detail. The link to this webinar is also included in our PDF of resources. Now, let's move on to a demonstration of how to maximize your ranking snapshot. As we've worked with communities throughout the year, we found that many have not taken advantage of the various tools and resources we've added to the rankings website. We'd like to take a quick walk through these resources live on the website. So I'm going to share my screen and we're going to take a little live tour. Okay, so hopefully everyone is now seeing the County Health Rankings home page. And we're going to start with the new rankings landing page. This new page brings together in one place the resources of the rankings, including our reports, a place to find your county's rankings, a guide to help you use the data. You can find out what and why we rank, our methods, and you can get information on why ranks change. And if you want to take a deeper look yourself, you can download rankings data and its accompanying documentation. So now let's take a look at a county snapshot. I'm going to pick Sacramento County, which is where my colleague Annie works. And type in Sacramento. Okay. So when I'm looking at a snapshot for the first time, the very first thing I generally look at is the trend graph for premature deaths. We added trends a few years ago, and I just find them to be an incredibly useful tool. Let's open this up. So what we see here is that in Sacramento County, premature deaths have been decreasing for the past decade, and at about the same rate as the US as a whole, and just a little higher than the state of California. So these graphics can give you a really quick sense of just the overall health of the county. It's, you know, a relatively average county in the nation, but a little bit unhealthier than the state that it lives in overall. Okay, so I'll close that. Another don't miss feature associated with premature death is our call-out box with causes of death. If you click on the I that's next to the measure, so that's here, you can see that the leading causes of death for Sacramento County under age 75. We include up to the top 5 causes of death in each county. Close that. So did you know that in addition to our 35 ranked measures, we also include on each snapshot about an equal number of measures that are not used in calculating the rankings? These we call additional measures. These additional measures are included for a variety of reasons. Some are there to provide kind of additional context to our ranked measures. There may be a different way of looking at the data. Some are measures that we might otherwise include in the rankings, but they're only available for a minority of counties. Some are unrankable measures. An example of this is healthcare costs, which is an important measure for communities, but one where it's not always clear if more or less spending would be good for the community. And finally, we include easy access to some basic demographic measures for your county, which can help provide context to understand the rest of your snapshot. Additional measures can be found in these little pluses. So that's first the county demographics. If I close that, then we can see the additional measures for health outcomes that are included. Okay, so let's move on to another measure. We're going to take a look at children in poverty here. We also include a number of ways that you can understand our measures more deeply. Last year, we added demographic data for several of our measures. If you click on children in poverty, which I will do, and look at the data table, you can see that we include data for Black, Hispanic, and white children where we have data available. We're adding some new functionality to this feature this year that we'll discuss a little later in the webinar. Another feature that we added last year is the Learn More About This Measure link. I'll click on that. If you're a person who's looking for our measures to be explained using more non-technical language, this resource is for you. It also discusses how our measures can be used or not used to measure progress, and what resources are available to get data at other geographic levels or for specific demographic groups. I'll just, can this measure be used to track progress, and what other resources are available? This is a great place to check out. Just going to go back to a measure page. One final and perhaps the most important feature here is the Policies tab. These data that we give you are intended to guide action. This tab will lead you to a curated list of programs and policies from our What Works for Health database. Here, I'll show you, that are related to the measure that you're looking at. This year, we've worked to create even tighter links between the measures and approaches and have added policies to our additional measures where it makes sense. So hopefully, you've learned about one new tool or area of our website that you didn't explore before. Now we're going to transition back to our slides with a quick poll. Allie, I'll let you do the switching.
Yeah, great. Thanks, Amanda. And so, as Amanda said, we're going to launch a quick poll, and maybe you are a County Health Rankings and Roadmaps super user who is familiar with some of the tools that Amanda just shared, or maybe you've never really explored a snapshot beyond looking at your county's ranks. And so, I'm going to launch a poll here, and we just ask that you mark all that apply. We're just curious which tools you've looked at before. We'll give everybody about 30 seconds or so to share their responses. It is you can select more than one answer, so let us know about all the great work you're doing. Good, it looks like we have just over half of our audience participating. Great to see you all joining in. All right, and we're going to end the poll and share the results in 3, 2, 1. Great, so it looks like there's a nice spread across all those tools, Amanda. Specific demographic data stood out and trends as sort of the two most frequently used tools, but looks like people are exploring the rankings, really checking out what resources are there.
Amanda, you might still be muted.
I'm sorry, everyone, that is true. I was still muted. So with all of these tools, what are we adding for the 2018 release? I actually want to go back and just look at that poll. That's so great to see that so many of you are using the demographic specific data. Like I said, we're trying to make that even easier to use. And since it was a new feature last year, I'm really happy to see so many users of that. So let's go on and see what we're adding this year. Okay, so first, in collaboration with the CDC, we're offering a new way to compare counties. Well, the rankings default is to compare counties within states. We understand that sometimes for some counties or some measures, the most comparable counties are in other states. This new tool pre-selects a list of counties that are comparable across the nation in population, in age structure, urbanicity, and important social and demographic factors to the county that you're interested in. You can pick counties from this list to compare your county's measure to, or to continue to pick any county in the US. This is something we've really heard from users that they're interested in, and so I can't wait to hear how people are using their peer county selectors. We're also excited this year to offer a Spanish translation of the snapshot in order to serve more audiences. Users who would prefer to read their snapshot in Spanish can click on the Español button at the top of the page, and all of the table headings, factor, and measure names will be replaced with Spanish translation. Many of the information buttons will also be available in Spanish. We're really hoping this makes our website even more accessible to more users. And so next, again with that demographic data, last year we started offering race-specific values for some measures in the data tables. This year, in order to make this data more easily available, these values have been added directly to the snapshot. For measures that have demographic data, and there will be additional measures that have demographic data, the county value will be clickable, and when clicked, a small table will appear. Please note that these tables will not be available on every snapshot due to data limitations. We only include those values that have an acceptable level of precision. We hope that all of you users will try out these new features when the website debuts on March 14th. So the website is not the only new feature of the rankings this year. For the first time in the rankings history, we've done a major overhaul of our state reports to provide these resources with added values to communities while emphasizing our growing focus on ensuring not only health, but also health equity. The County Health Rankings has been illustrating for the past 9 years that where you live matters to your health. The new state reports will take this a step further and show that health not only varies depending on where you live, but can also vary depending on your race and ethnicity. So what will these show? First, they'll show what health equity is and why it matters. It'll show differences in health outcomes within the state by place and racial ethnic groups. It'll show differences in health factors within the state by place and racial ethnic groups, and what communities can do to create opportunity and health for all. So what do we mean by health equity? I thought this was worth discussing because it really didn't show up in our model, and I want to make sure we all have a shared understanding of this because it's really important for these state reports. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. This requires removing obstacles to health, such as poverty and discrimination and their consequences, including powerlessness and lack of access to good jobs with fair pay, quality education and housing, safe environments, and health care. Achieving health equity means reducing and ultimately eliminating unjust and avoidable differences in health and in the conditions and resources needed for optimal health by improving the health of marginalized groups, not by worsening the health of others. Our progress towards health equity will be measured by how health disparities change over time. These new state reports provide data on differences in health and opportunities in all 50 states that can help identify where action is needed to achieve greater equity, and they offer information on how to move from data to action. In this report, you'll find a series of graphics that illustrate how health outcomes and some health factor measures vary among counties and among racial and ethnic groups within states. In this graphic that we're looking at, you're looking at differences in the overall measure of length and quality of life by place and among racial and ethnic groups within this example state. Each state will have its own graphic. It shows that in this example state, meaningful health gaps persist not only among counties, but also among racial and ethnic groups. For example, Black and Native American residents in this state have poorer measures of health outcomes than Asian, Hispanic, or white residents. We can also see that the length and quality of life values for Black residents are most similar to those living in the least healthy quartile of counties. These graphics are going to look different for every state, and you may find that the story of health outcomes in your state is quite different. In some states, the differences among counties are much greater than the differences among racial and ethnic groups, while in other states, those differences are substantially smaller. Our next step is to take a look at what's causing these important differences in health. So health is influenced by a range of factors. Our model showed that. However, social and economic factors like connected and supportive communities, good schools, stable jobs, and safe neighborhoods are foundational to achieving long and healthy lives. These social and economic factors also influence other important drivers of health and health equity. In the next section of the report, we focus on 4 foundational measures that illustrate the opportunity for health that's important for all people. These graphics, like the example here, using child poverty, high school graduation, uninsured, and teen birth rates, will allow readers to explore differences in measures by place and differences by and among racial and ethnic groups, and to examine patterns across measures in the size and nature of these gaps. So this is an example of the children in poverty graphic, and it illustrates that in this state there's relatively large differences both among counties and among racial and ethnic groups in terms of child poverty rates. Native American, Black, and Hispanic residents in this state are experiencing more child poverty than white and Asian residents. In fact, Native American residents' rate of child poverty is higher than the county with the worst rate of children in poverty in this state. A key takeaway is this: whether we're talking about place, or racial and ethnic gaps, both need to be addressed when we're working to improve community health. Okay, so we ask you to consider this series of questions as you look at the data graphics throughout the report. What differences do you see among counties in your state? What differences do you see among racial and ethnic groups in your state? How do counties in your state compare to the US counties? And what patterns do you see? For example, do some racial and ethnic groups fare better or worse across all the measures or just some? We're really hoping that states can dig into this data. So we want these reports to give states and communities a better understanding of how opportunities to be healthy are distributed throughout states. But how do you turn this data into action? We include in this report some evidence-informed approaches to consider as your community moves forward, or your state. These approaches are drawn from our What Works for Health database. Going there, you'll be able to read all about the evidence behind the strategies, get examples of implementation, and get a sense of the potential impact the strategies can have on disparities. So that's a quick, high-level look at what to expect for the 2018 release. If you're interested in your state reports, once you see them with your actual state's data, please come to our webinar focusing on these new products on March 27th. So now we've got a few minutes for questions.
Yep. And I just want to remind people, as much as you can, put your questions that you have for Amanda or myself later in the Q&A box. Some of you are sending them in via chat, and we are monitoring them there. It's just a little trickier to monitor in the chat box. So if you've got specific questions for us, we'd love you to share them in the Q&A.
Thanks for that reminder, Kate. And Amanda, I'll kick you off with a question. This came in from a community, should we use the rankings to monitor progress in our community's collective action plans?
Oh, that's a great question. We get a lot of questions about using the rankings for measuring progress, and have tried to add some resources over time to really answer that question. It's not actually simple. Ranks are not the best mechanism for measuring progress. The way ranks change are really dependent on a lot of things. Some of them have to do with how your community is doing, but some of them have to do with how counties around you are doing. So we really ask that that counties look in a little deeper at measures. And some of our measures are really well suited for measuring progress, and some are less suited, less well suited. And in our Learn More section, the Learn More about these measures that I pointed out that we added last year, we really try to discuss what the advantages and disadvantages of each of our measures are for measuring progress. So I used to be an evaluator, and it's a tough thing, learning how to measure progress. But we're hoping we're providing the information that people need to use our measures.
Great. And so here's, and there's a lot of great questions coming in. I think we'll maybe do one more, and then just a reminder to everyone, if you can stay on to join us in the discussion groups immediately following the webinar. How is it best to interpret the county health rankings outcomes versus other data sources which may tend to differ? What should folks share with their Board of Health?
Yeah, this is another question we get a lot. There are a lot of sources of data. For example, I'll just use children in poverty. We get our data from something called the Small Area Income and Poverty Estimates, which is a program of the Census Bureau. But that's not the only program that estimates child poverty rates. There are multiple surveys that you can get that information from. So there is no one single correct rate of children in poverty. And we oftentimes will get questions saying like, oh, we hear the smoking rate is this when we look at this survey, but from the county health rankings, it comes out a little different. The important thing is to really triangulate data sources, to take the information that you can get from one data source to another data source. And they all have their pluses and minuses, and it's really about weighing them. Another issue we get is that our data, while we certainly use the most recently available data at the time of our release, 11 months later, it's probably not the most recent data available. So being careful to make sure that you're comparing apples to apples, that you're comparing the same years of data. We oftentimes combine data in order to get estimates for all counties in the nation, but not every county. Some counties are big enough that they don't have to combine data in order to get estimates. So there's a lot of reasons why those things don't always match up. And the best thing to do is take a close look and contact us if you have any questions. We're always happy to help with that.
Great, thanks, Amanda. And I think, so like I said, lots of great questions, and keep those coming in, but I think we're going to move on now. And we're always talking about moving, the opportunity to move with data to action. And so today we're going to provide some tips and strategies for making the most of the rankings release and using it as a call to action for your community. I'm going to turn to Kate now to walk us through that.
All right, thanks, Allie, and thanks, Amanda, for the data overview. It looks like lots of people were excited about some of those new resources. So to quickly recap some of the resources that you heard about that you might want to leverage, depending on your audience, are the model of health that Amanda shared early on, the rankings themselves in your county snapshot and county level data, and then the state reports. So before we get started, I actually want to do a quick poll using the raise your hand feature. So I noticed some people have been raising their hands already, but using the raise your hand feature, raise your hand if you've had a story in your local paper or on the radio about the rankings. All right, my little raise your hand flasher is going crazy right now. So a good number of folks that have had a story. All right, awesome. But lots of opportunity for more of you to see if you can work that media angle and get some coverage and information out there about health and health in your county. So remember that we rank for a reason. We do it because it's a bit provocative and we want to get people talking. As I said before, ranks are great for garnering attention. When using the rankings release as a call to action, think about being proactive. Who needs to hear your story and why? And how can you share it with them? For example, the media can help you connect with a broader audience, and we'll talk about some tips for working with the media to help you get your story out. You might also use it as an opportunity to connect directly with other community leaders and partners who you want to engage in this work, either to start or broaden the conversation about health and equity in your community. Or you might use it as an opportunity to call attention to current work that you're already doing and invite others to join you. So we're going to first start and talk a little bit more about using media to get your message out. So our communications partners work with folks in each state to help get the message out about the rankings each year. And this results in significant media attention at the national, state, and local level. We encourage you to do some proactive outreach with local news outlets to draw attention to health and any work that you're doing to improve health in your community. Connecting with the media is a key way to reach and influence decision makers, including the broader public. And if you do get media attention, there are a few things to keep in mind. First, you control the story. So think about what story you want to tell. You might think about using the 2793 tool, our media advocacy toolkit, and other tools from the Communicate Guide to help you craft your message. And we've included links to these tools in that resource handout that Ali shared early on. Next, your story should focus on action and assets. What are you already doing? What are the strengths of your community? And it should also include a call to action for the community. How can they get involved and be a part of the work to improve health? Finally, think about who can help tell your story. Are there partners that you could include that might help increase media attention or increase your credibility with key decision makers? So remember, when using the media, you have several options. You can send out a press release or contact your local newspaper, TV, or radio station to run a story. You can write an op-ed or a letter to the editor. And always keep in mind that if you're in a smaller market where traditional media might not be an option, you can use social media to put your story out there. Some of you might be thinking, my county doesn't rank that well. I'd rather not call attention to that, which is understandable, but let's think about how you can use that to your advantage. It's important to remember that being a low-ranked county doesn't mean that your story should focus on what's not going well or on that lower rank. You can use the rankings as an opportunity to highlight the good work that's going on. Use it as a rallying point, just as two of our RWJF Culture of Health Prize winners did. So the Bronx and Menominee County, Wisconsin are low-ranking counties in their state. Actually, they're the lowest-ranked county in their respective states. And they're both prize winners who have used the rankings as a call to action. Their stories just reiterate that being low ranking doesn't mean that there isn't great work happening and improvements in both health outcomes and health equity. So share those stories and make that your narrative. Reporters might ask why your county is ranked at or near the bottom, and you can share some of the challenges, but really try to focus on the systems that are in place that create barriers to health in your community, more than focusing on just one specific health issue. And then pivot to solutions. And don't forget to highlight the community's strengths. Every community has them, whether it's around a specific health area. You know, maybe your community is really resilient. They have a great collaborative spirit, lots of stick-to-itiveness. Find the good and make sure you're highlighting the great things that are happening in your community. And if you're looking for a little inspiration, I do encourage you to watch the videos from the Bronx and Menominee, and we put links to those in the resource handout as well. Another important messaging consideration is to call attention to the differences that exist within your county. And this is important for all counties, but this can be a really great strategy in particular for higher ranking counties. You might think it's easy if you're at the top. That actually comes with its own set of challenges. There might not feel like there's the same sense of urgency to change the conditions in your community, or you might feel that it's harder to find a compelling story. But the differences in opportunity and outcomes within your county can help you shape the narrative to move people to action. Who isn't doing as well as it might look based on the county level data? Who isn't thriving? As Amanda mentioned earlier, we provide data for some measures stratified by race. Children in poverty is one of those that she showed earlier. In Dane County, where I live, the overall rate of children in poverty doesn't look too bad. But when we look at the numbers by race and ethnicity, it's really quite alarming. And this huge disparity is a huge focus for our community right now. And again, the Dane County is a higher ranking county. This becomes a great focus point for remembering that while there's lots of great things happening, we also have some significant challenges to deal with. Also recall that the state reports this year will have an increased focus on equity and gaps by race and by place. While the state reports will focus on gaps at the state level, you can use those reports as a great starting point to bring an equity focus to the conversations you're having at a local level. What do the differences look like in your own county by neighborhood, by race and ethnicity? Who doesn't have the same opportunity to be healthy? And remember to give yourself credit for what's going well and take a moment to celebrate that, but then bring the focus back to the work that needs to be done and make sure that those good things that are available to everyone. All right, so media coverage is one of the important ways to bring attention to health in your community. And in addition to using the rankings released to get your message out, you can also use it as an opportunity to connect and engage with key stakeholders. So let's talk a little bit more about that. One of the key messages of County Health Rankings and Roadmaps is that everyone has a role to play in improving health and advancing equity. The rankings release is an opportunity to connect or reconnect with stakeholders in your community. Obviously, we want to connect with these folks on an ongoing basis, but think about if the release might be an opportunity to reach out to someone new or to reflect with current partners on your ongoing work with a little bit of new information at your fingertips. There are lots of examples of things communities have done to engage partners, and I think the first thing to think about is, who are you trying to engage and why? Are you working to build a common knowledge base? Are you trying to build political or public will to take action? Are you trying to reinforce action that's already ongoing? And this will really help you define your approach. You might consider hosting an event, a community meeting, scheduling a one-on-one conversation with a partner or a policymaker. We'll walk through some examples of two groups, policymakers in the community, but I encourage you to visit our partner center to get additional ideas about how you can reach out to other sectors. Again, there's a link to that in the resource guide. Another thing to think about is what's the best tool or information to lead with. So the County Health Rankings model might make sense for someone who might not yet fully see their role in building a healthy community. The data for someone who wants to really understand what's driving health locally. And you might think about using the state report if you're really wanting to focus the conversation on equity or if you're working at a state level. And if you're using the model as a starting point for conversation, we do have a County Health Rankings model discussion guide, and that might help you frame your conversation. So we'll talk about some things that we've seen communities do, but we'd love to hear from you about what you found to be successful. So send your ideas and examples in via the chat. Remember to share with all panelists and attendees, not just the panelists, so that everyone can see your ideas. All right, so our first group of stakeholders, elected officials. Elected officials are a group that many folks want to connect with. They have the power to change policy, so that makes sense. At a state level, groups have held meetings with legislators. Sometimes they've done a legislative breakfast or other kind of event, and sometimes they've just gone and done individual visits with specific legislators to share the state report and county level data for the areas they represent. Maybe it's to find a champion for a specific policy, or again, to sort of build some common knowledge base. This year, we hope that the new state reports that provide information on the differences in your state by race and by place for some of those social and economic factors provide an even more compelling reason to reach out and connect with state elected officials to talk about how they can support creating opportunity for health across the state. At the local level, you might think about bringing this to the Board of Health or county board, maybe to your mayor or other community officials. It's likely going to depend on the size of your community and what, if any, relationship you have with these folks already. But again, just like with the media, know what the story is that you want to tell before you go, and know what you're asking them to do. The broader community is another important group to connect with. Remember, there are people behind the numbers, and it's important to understand their experience and perspectives. Community members bring a breadth and depth of local knowledge. And they know what solutions will work and what hasn't worked in the past. They can also help to identify and access resources within the community. We focus so much on the deficits, but what are the assets? You can connect with the community to hear about how these issues look and feel. What are the challenges of food insecurity, and how are they really impacting people on a day-to-day basis? What's happening in the community around jobs and housing? What are the real challenges that people are facing? What's important to them? What do they care about? And what ideas do they have to make things better? The data is really a starting point, but the community can add a lot of important context. Groups have hosted community forums aligned with or in the weeks following the release to share the new data and start these conversations, or just to use it as an opportunity to bring a health focus to ongoing conversations that communities might already be having. You can also look to join meetings or existing events at community centers or other neighborhood meetings. Think about where and how people in the community are already gathering and meeting and ask to join them. You might not need to plan a whole new event. One of my favorite quotes from one of the folks we work with is, the community is already organized. So sometimes it's not you organizing them, it's you finding out how they are and being part of that. You might also think about how to use social media. This is a place where some parts of the community spend a lot of time. Again, especially if people maybe are more spread out, this could be a great opportunity. How can you reach them there and engage them in the conversation? So in short, there are a lot of ways to leverage the energy of the rankings release to bring attention to health in your community and the efforts that are underway. You can use the media to get your message out broadly. You might look to expand on the work you're already doing by engaging new partners, or you might look to re-energize some of the work with existing partners. Think about what makes the most sense for you based on your current work, where you're at in this journey to health improvement, and where your existing partners are and where you need to reach out for more. So regardless of who you're connecting with, make sure you have a purpose. Understanding why you're making the connection and what's in it for the people you're connecting with is really important, because we want to make sure we're always making good use of people's time. So with that was a quick overview of some ideas on how you can use the release to get your message out and connect with others. We want to hear what questions you have, either about what I just shared or some of the data information that Amanda shared. As you're sending your questions in, and I can see we have a lot already, we're going to send out the chats in just a bit to the 2 discussion groups that will follow, and we'll be moving over to Zoom meeting for that. A little bit different than Zoom webinar. Again, one of those meetings will be with Amanda and Allie, and that's going to have a bit more of a data focus, and one with me and Annie, a little bit more on the communication side of things. But if you want to discuss both topics, either room will work. And just make sure that you pick the link for the group you want to join. Don't click it yet. Wait until the end of the webinar. We'll send them out again at the end of the webinar. They're also in your slides if you downloaded those. The PDF. Just one more thing about the discussion groups and what to expect. These are virtual meetings. It's not a webinar. You'll be on video. You'll be able to talk to us, though there's also a chat if you prefer that method of communication, but it's much more interactive, so we just don't want you to be surprised when you get there and come in the room and find out that it is really discussion-based and an opportunity for a bit more interaction. So now I'm going to stop talking and turn things over to Allie and see what questions we have.
Yeah, great. Thanks, Kate. And I'll give you a second to catch your breath and maybe start by asking a question of Amanda. Amanda, we got quite a few questions about the Compare Counties tool and how counties might use that. So I'm wondering if you could just touch on that a little, just go back to that for a minute here and share a little bit more about how and what that helps counties do.
Sure, those are great questions. The rankings are really all about comparisons. We're comparing counties to each other, but we do that at a big summary level where we're combining a lot of measures and into some very big summary measures. Well, you might be interested in how do the specifics of your snapshot compare to each other, and the way our website is laid out, it's just not that simple to do it without our Compare Counties tool. So it seemed like a number of you have used that at least, but it'll also be this year. The thing we've added to it is this idea of peer counties. Sometimes people need a little guidance, like who are the communities who it would be good for me to compare to, communities where they're kind of similar to me. I'm a rural community who has a lot of young people, or a college community. And so this is a way that the CDC, a method that the CDC has used to identify peer counties to you, which can be another way to understand, am I, missing the mark among my peers, or am I even exceeding the mark among my peer counties? I think it'll be really exciting to see how people use this. It can be a different way to set standards than your state average or the national top US performers that we've included for years. So we're really excited to offer this. Hopefully that helps. I wish I could take you on a live tour of it, but you'll have to come to the next 101 so we can really work through that new feature. Great,
thanks, Amanda. And Kate, I'll pivot to you, and this is a question that involves a little bit of the rankings, but a little bit of the inspire and engaging with community. This comes from a county that is ranked at the bottom year after year, and they're just curious how they can inspire the community with hope.
Yeah, that's a great question, and I talked a little bit about that with the media when you're a lower ranking county, but I think a couple of things to keep in mind here. One is, ranks are relative, and they're also going to take some time to change. And so it's really important to pivot away from that rank. We're the county health rankings, and then we're telling you don't pay too much attention to that. Again, they're a great communications tool. But they don't always do a great job at measuring all the progress that's happening in a community. And that's because, again, they're relative. You may be making great progress, just not quite as quickly as others, or you maybe just haven't caught up yet. So pivot away and look at what's the great work that's happening? What are the strengths of our community? Where are we making progress? And even looking at the data, if you can find some of those trend graphs that are green, focusing on the positive points. I've been in a lot of lower ranking communities, and the work that's happening there, the resiliency of the people that are there is inspiring. And I think, again, it's the pivot from the rank and remember that's just one very small piece of the puzzle, and really focus on what are the strengths, what are the assets, what's the good work being done that we can continue to build on and make forward progress. And I think that is a way to, and celebrate that. You don't have to focus on the rank. Celebrate those good things and remember to do that so that people do remember the good that's happening and can have that as a focal point as well.
Great, thanks, Kate. And I know we've got a couple of slides here to wrap us up, so I think I'm going to turn it back over to you to walk us through those.
All right. So yeah, guys, we've got lots of people on this webinar and lots of questions. If you're able to stick around even for, a couple more minutes to join us on these discussion groups, we'll be able to dig in a little bit deeper into the things you're asking, and again, talk a little more freely where you can hear your questions and you can ask some follow-ups. So Allie will send out those links to those discussion groups, and make sure you pick the one that you want to join. But again, we'll be able to talk about data and rankings as a communication tool in either, so either will be fine. As Amanda mentioned, if you want to dive deeper into the new state reports that Amanda previewed, join us on March 27th, 1 month from today, for our webinar, the 2018 County Health Ranking State Reports, How to Use Data from These New Reports to Improve Health and Increase Equity. It's a long title, but we wanted you to know what we're talking about. This webinar is really going to support and encourage you to use those state reports to pursue action in the range of factors that influence health and equity. We'll discuss key findings from the data, differences in outcomes and opportunity based on place and race and ethnicity, and some specific evidence-informed approaches for taking action. So be sure to review your state's 2018 report when it's available on March 14th, and come to the webinar with your questions. Again, you can follow us on Facebook, on Twitter, and you can sign up for our newsletter, especially this time of year with rankings coming up. We'll be putting out some information to help you get ready and feel prepared, and be able to also create that drumbeat in your own community to share new things on Twitter and Facebook to get your community prepared for what's coming as well. So thank you all. I know we're a few minutes early, but hopefully, again, you can pop over to Zoom and join us there. We'll be there for up to an hour, but if you can only come for a couple of minutes, we welcome you to join for as much as you can. And there are those webinar links, so just check those last 3 numbers for which room you want to join, and we will see you over in the Zoom meetings.